I did a little bit of a comparison of some of the countries in Asia Pacific, China, India, Singapore, Pakistan, Australia, and Malaysia. And I looked at the percentage of GDP they attribute to healthcare, life expectancy, the percentage of the population over 65, etc. And I want you to describe the healthcare in Pakistan and the system the way that you see it. The data shows that the percentage of GDP for healthcare is quite low, so 3.38% according to the World Bank data from 2019. Also, the life expectancy is relatively low, 67 years, while, for example, if we look at Australia and Singapore, their numbers are 83, 84 years, which is really high, well above other averages. So how would you describe the healthcare system in Pakistan? What are your experiences?
Yeah, Pakistan is the fifth largest country from the population standpoint, and 50% of the people does not have access to healthcare. So what happens, so if they don't have the access to healthcare, so they are using some of traditional ways and means, or maybe some doctors or nurses are sitting at the villages. For them, who are the doctors and who are everything, and sometimes they do maybe surgeries as well, or maybe they are using some of maybe painkillers or some other stuff, so that people feel relieved fast, and ultimately it has obviously long-term effects on their health. And in Pakistan, I would say it's mostly the government-driven healthcare sector, but there is about 65% is government, and then 35% is from the private sector. So now private sector is just putting more investments by building the hospitals, and especially primary care is also in the process of setting up. So another thing that's pretty important from Pakistan's standpoint is a lot of people put their money for donations, and a lot of organizations are doing charity-based hospitals and healthcare services into rural setting. So that is one of the area that is picking up fast, and lot of investments are coming to Pakistan in this specific area. So it's a mix of things. So obviously it's way behind even in the region. The medical education in Pakistan is very much at the top level. And if we see, a lot of doctors are just working out of Pakistan. So about maybe 20,000 doctors from the country are working in states alone. So those people are bringing best of their knowledge, best of their expertise into the country. The process of a transformation, it's slow, but there are quite a few success stories as well.
I'm glad that you mentioned the doctors, because I also looked at the number of doctors per 1,000 people, and the average measured in 2019 in Pakistan was 1.1, which is low. For example, if we compare it to India, India has even lower average of physicians per 1,000 people, 0.9, but more kind of European numbers would be 2.8, 3, 4. Australia has 3.8, for example.
Yeah.
So how do you see that? And this is pre-pandemic numbers, and we know what happened to doctors during the pandemic. Either they went to a different industry, or they quit, or went to work somewhere with better working conditions.
Yeah, roughly in Pakistan we are graduating about 1,000 doctors, or maybe 25,000 doctors per year. Most of them are just getting abroad. Maybe they prefer to work with NHS, they prefer to work with Canada, and they prefer to go to US for their education. And once they go there for further education, then usually what happens, they stay there for a longer time because they find it more systematic, more opportunities are there, so they prefer to stay over there. So this is like a kind of, I would say, a brain drain that's happening over here. So for people for better career moves to the established world, and obviously that is also creating a problem. Then there is another big problem, so that's bigger than this one. Most of the females who are graduating from the medical colleges, and we have more females are graduating than the males from the medical colleges, and there are studies about 87% or maybe something about above 80% females are not actually coming to the field. They get married, they start looking after the kids, and they are not active into the system. But on the other side, there are few startups who are working to engage those doctors who are sitting at their homes, and still they can use their knowledge, their expertise to provide medical consultations by using telemedicine platform.
You are considered one of the top people in digital health in the world. You're highly recognized by HIMSS. You have represented on the highest level to make the regulations, develop the learning certifications. So how do you see yourself working for developing countries, and what's your driving force to transform the healthcare sector for Pakistan? Because if I'm not mistaken, you spend the majority of your time in the US, right?
Yeah. So basically, I had been involved with the Department of Health and Human Services. I was part of their innovation committee. I worked with the ONC, and with HIMSS, I had been putting all the regulatory frameworks, especially on mobile apps. But obviously, that's a pretty much structured world. And if we come back to these developing countries like Pakistan, not much of work has been done. So it's I would say a green field. The most interesting thing when we see the places like US or countries like Germany, like France, or even UK, so they have everything pretty structured. They have different kind of challenges. They have the data, they have the systems in place. But when we come back to Pakistan, we don't have the system, we don't have the data in place. Most of the healthcare work has been done manually, and people are not very receptive to the transformations actually. So it has been a mix of things. We use different techniques to bring them in to digital health. Few successes, many failures, but just taking few examples, I think now the world is totally changed. Knowledge is everywhere. Everyone has the access to the knowledge. So knowledge is not an issue. The issue is implementation of that knowledge to get something impactful. So into that area, we have done a phenomenal work in Pakistan. That was to build the systems for the COVID. So we built those systems. We call it integrated disease surveillance. Sometimes we call it disease early warning system. So that was a fantastic work that we have done, and I represent those case studies onto different conferences with Cleveland Clinic, with him, even into these conferences in Africa. So that is quite interesting thing, and I think there is no way we can just get away from the medical records or putting together. But most interesting thing that I see, the young people, especially the youth, they are doing phenomenal jobs.